floor is yours, Dato.
Thank you, Mikhail, and thank you very much for participating today. And it's a very difficult topic to discuss because, as you know, human body is very complex, and one component that is very complex for us is endocrine system, and it really complex because it has a lot of feedback loop control system in our body. It's all about level of hormones, and that will have a big impact on our metabolism and the rest of the part. Heartbeats, for example, yeah, is being controlled. Our body temperature is all controlled by the endocrine system. So a network of organs that is secreting level of a chemical called hormones or steroid in our body, natural steroid in our body, that then will regulate a lot of our body function. And so obviously if we have over expression of the hormones or under expression of the hormones, it will cause the imbalance. And so the imbalance is the one that get our body system going crazy. And not only that, it's difficult to pinpoint. You will get certain things, you're not feeling comfortable, you have some nausea, and you may have body temperature issue. You feel you can't get, I mean, if the temperature is too cold, you cannot control yourself. And then you have to check whether you have these endocrine disorders in the system. So today I would like to trying to open up the subject so that you get a bit more understanding, and hopefully with this we hope to take whatever step are necessary to ensure that we don't end up having all these issues about our endocrine system. So the agenda this evening, I would like to introduce the endocrine system, the causes of the disorders, a little bit about the feedback system and types of endocrine disorders, prevention, and of course we talk about the self-produced hormonal therapy as one of the effort that we can do to ensure that we do not have this problem with hormone imbalance. So I hope by the end of the program you have a bit of better understanding about our endocrines and what are the issues at hand. At least with this kind of knowledge and information will help you to make some decision for yourself and your family. So the endocrine is a network of glands and produce and releases hormones that control our body functions. For example, metabolism, let's say burning some calories, influence your heartbeats, your body temperature, how your bones and tissue grows, even your ability to make babies, you know. So it all depends on our endocrine system. And sometimes you say, "Woo, I got adrenaline rush," right? You feel like, wow, you're doing something. That's actually the expression of the adrenaline, which is part of the uh, adrenal organs, which is near your kidney, adrenal glands, that will help trigger whether you want to fight or you don't want to fight. So that's all about adrenaline rush, and that influence your thinking process and how you take some action. So sometimes when you play games, you say, "Ooh, I got my adrenaline up," you know. And also when you don't have enough sleep, you got cortisol, release of cortisol in your body. So that also a signal to your body that you are not having enough sleep, and then that triggers. And so these are the system in our body, as you can see from the diagram. Your thyroid glands, which is a kind of a small thing near your neck base, and so it affects metabolism. And then the parathyroids, which is slightly lower, it helps regulates level of calcium in the blood, your testes, your kidney. One of the issue when you have a kidney failure, you cannot produce enough erythropoietin. So erythropoietin is kind of a hormone that regulates the production of your blood, and so you have to be injected if somebody we have a kidney failure, and this is also a big issue when somebody got diabetics. Once the diabetics, then it gets into kidney failure, and after kidney failure, then you have to be injected because kidney also part of the endocrine system. It produces several types of hormones that regulates your body function. So these are very complex in nature. Until today, science cannot basically pinpoint. And so what I'm trying to say here, until today, we do not have the real solution if we have endocrine disorder. So I think these are a continuous effort by scientists and also doctors to find a way uh, to solve this problem. And so there are two types, let's say a group, two categories of that can cause the endocrine disorders. One that results when the glands produce too much or too little of the hormone, and then what we call a hormone imbalance. And then the other component is treatment of tumors that may disrupt the production of hormones on your organs. So the endocrine has a feedback system that help control the balance of hormones. That means if the system sense that there's not so much hormone in your bloodstream, and then the organs or these organelles will start to produce the hormone. So this is all about balancing act and to ensure that you have enough. And so the feedback system will rely on signals, also the blood circulation. So if you don't have a good blood circulation, then there's a problem because then the system cannot sense the level of hormone in your bloodstream. So that's also another issues at hand. So these are the causes of the endocrine disorders. The endocrines are the feedback system. You can see from the picture, hypothalamus, pituitary glands, and thyroid glands, they are all interconnected in terms of releasing certain hormone that creates another of the glands to produce another level of hormone. And so there's always a balance between these glands that produce this hormone level. So hormone imbalance may occur if the feedback system has trouble keeping the right level of hormones in the bloodstream. Yeah. And then, for example, you can also see some people are very big, giant. So that means they got too much of human growth hormone produced, or you got a dwarfing issues when you have not enough growth hormone being produced. And for us, actually, when we reach certain level, we do not have any more human growth hormone actually being produced in a high level because otherwise you keep growing. So human growth hormone is also part of what we call the endocrine system. So for a normal human being at a certain age, then the human growth hormone level will drop. Some people, they say, okay, they want to get injected with human growth hormone to stay young. So that's also some controversies but nobody can say it's right or wrong, because some people claim that by injecting a human growth hormone once a year, they say they keep themselves the aging process getting slower. So that's what I say. Yeah. So this is still scientists looking at that, and some has some this knowledge. Some may not share this knowledge, and so it all depends on this group of scientists and doctors. So they're looking into that. And one of the aspects, the most notorious endocrine disorders is actually diabetes. When you do not have your insulin being regulated, then your blood sugar or the glucose level in your blood will not be able to be regulated. So you have too much of the blood sugar in your system. That means there's not enough insulin being released, or your alpha cells in the islets of Langerhans in the pancreas doesn't control the level, and so then the system cannot control the level, then you have a lot of issues with your glucose or the sugar level in your blood. Then when you have a lot of sugar level in the blood, and then when you have, let's say, a prick, then the bacteria will love, because they sense a lot of sugar in the bloodstream, and that causes a quick infection. And because of also the level of sugar is too high in your bloodstream, then the body system cannot get the self-healing process, and so you have an issue with this problem. So increase or decrease level of endocrine hormones will cause problem in the feedback system, or we call it hormone imbalance. It causes a lot of diseases, genetic disorder like hypothyroidism, means that you don't produce enough hormone from the thyroids, or you get some infection that can also cause a problem, or injury to the endocrine glands, or a tumor. So these are some of the issues that can cause disorders. Yeah. So there are many different types of endocrine disorders. Some are basically genetics, so you pass on from the parents to the children, and there are issues like Cushing diseases or Cushing syndrome, particularly children who take high doses of corticosteroid medication. Sometimes because of that, it can cause the pituitary glands hormones to be overactive, and then the children may be hyperactive, and so that's some of the issues at hand. Adrenal insufficiency can cause fatigue, stomach upset, dehydration, skin changes. So these are the issues that very difficult to pinpoint. For example, you have this symptom, but you cannot pinpoint to say, oh, you have some issues with the hormone level. So these are some of the things that give you an indirect kind of signal. Basically, your body cannot tell you, okay, hello, you don't have enough, or your adrenal glands doesn't work. No, the only thing that they can give you a signal that you always have this issue of fatigue. You're not having enough energy. Your stomach always upset. You always feel thirsty, you dehydrate, and your skin changes. So only thing is that when you have this kind of several signals, then you may have to go to a doctor and do some tests to see whether you have these issues or not. And so I would say it's very difficult to pinpoint, but it happens to a lot of people. And for us is, how do we do to prevent test about this 2020. So I have to make sure you include iodine in your diet, so that
Yeah, so I think
help your thyroids, yeah, to choose the iodine salts. Yeah,
I'm sensing some lag on your side. I think the internet lag on your side.
Oh, okay. Sorry.
I
I
think
think
it's better now. Okay, it's better now. Better now.
Okay.
All right. So
Yes.
Dato,
Yeah.
you were saying, I mean, with all these symptoms that that we can suspect. So normally, if we want to identify what kind of endocrine disorders are happening to ourselves, we would go to a clinic or a blood. We would take blood tests,
Yes, do a
or
blood test.
sometimes blood test or urine test lah, basically. But in
Urine can
yes,
give you a certain signal
yeah,
because urine carries some of the signal.
Yeah,
but
and
blood
then and
also carries some signal. Yes.
yes, and then some cases the doctors would advise to do a specific hormone test
Yes.
if that's what they suspect.
Yeah. So for let's say ladies, we call it menopause. Yeah.
Yeah,
So
yeah,
they have to go for hormone therapy.
yeah.
Sometimes I make a joke lah with my wife. I'm also have the menopause.
Yeah, we do.
Not
I
only
think
ladies,
the
actually, men also have a problem.
yes, that's
Of
that
aging.
is what I believe that's called the andropause for the men, the
Yeah, yeah,
andropause.
menopause.
So,
You're
but I
right.
mean, yeah lah. But if we do suspect or through all these tests, we found out that we have a certain endocrine disorders. So, what would happen? Or what would the doctors do with us? Normally, I mean, as far as I know, doctors they would give certain synthetic hormones or
Yes, yes. They give you
medications.
a hormone therapy,
Yeah,
but
yeah.
always when you have this hormone therapy, then other side effects will come in. So that's also always an issue.
That's what I
Uh,
suspect also. That's what I suspect
yeah,
also because a
and,
hormone, as
yeah,
far as I know, hormone is a very delicate um it is a very delicate issue to handle because
yeah, yeah, yeah.
a certain, let's say if we have a spike of a certain type of hormone, it can throw off like the balance of other types of hormones in our body. So I think sometimes if we want to take injections or take medications from doctors or even under doctors' advice, I think sometimes we risk throwing off the balance of other types of hormones in our body.
Yes, yes. I mean, kalau marah aja cepat-cepat marah tu mungkin hormone imbalance.
Yeah, yeah,
Okay,
yeah. That's
there's also another problem. When our body control the balance, you see the feedback system. So the body has a way of controlling the level of hormones in our body. But when
yeah.
you take medication, like say injection or
Mhm.
tablets or whatever, you take a steroid, right? You
There's no
can't
way to
control.
control.
There's no way to control because when you take
Okay,
it, you have it at a higher level unless you go for what slow release mechanism, but still it's not a control mechanism. It's just
I
that
see.
it's slowing the release
I
of
see.
the material, but it cannot have a feedback loop to control. So
Yeah,
that's why the side effects come to play because there is no way to control a mechanism if you have an imbalance and your system of control is not there. So by
mm-hmm.
taking a steroid or a hormone therapy, I mean, you try to increase the level,
Yeah.
but you can't do that in a way that the body does. Okay,
Yeah,
so
of course. That's only one part of the issues that you were
yeah,
telling us. The other
yeah.
part being, let's say our hormonal glands, our endocrine glands. If
Mhm.
there, you were saying that if there were some tumors on the glands that can prevent the secretion of some hormones,
Mhm.
and this one definitely we have to go for surgery and all these
Oh
things.
yeah, yeah. This one is we hope we don't get it now because this one is very severe because
Yeah,
it's now you're talking about tumors or
yeah,
whether it's benign or malignant. So then it's
yeah,
kind of a cancerous issue. So
yeah.
because and then now you have to put it, you have to balance which one you want to attack first. You have to attack the cancer and maybe you
The
have to have
tumor
a
first. Yeah,
remove the tumor. So we hope this will not happen to us. But most importantly, I think the imbalances can be caused by habits are not
mm,
healthy, such as not enough
yeah,
sleep, as
yeah.
well as the intake.
Mm,
So because when you ask why this thing happened to us, I mean, there must be certain things that trigger the imbalance of the hormone, and normally because of the bad habits. So we don't have enough sleep all the time, and so we push our body system to the extreme, the stress level too high. Then we don't take enough water, we don't have balanced diet, we got a lot of stress and poor blood circulation. So these are the whole thing that may cause a trigger because when you don't have enough balanced diet, then it also trigger cancerous issues when you take certain things that and the stress level too high and it causes some genetic changes and that causes a problem. And so I think these are something that we need to look at for our health. But most importantly, I think we have to have a balanced hormones, and so if we go imbalance, then everything will go wrong. Pasal tu marah aja, everything get easily, throw off and get angry and so on and so forth. So and so these are some of the issues lah. Okay, so I think what we're trying to do today is actually to also look at the prevention component.
Yeah.
The prevention component is that okay, we know, let's say we have to do something about it, and so incorporating something to be part of our habit. And the beauty part of Eva cream is that you are not taking, or you're not ingesting it, but you put the cream.
Yeah.
And the cream has some good properties, and I think especially the diasporia extract, which is the wild yam. It shows it has quite a good properties. But not only that, I think Eva cream has also grapeseed, aloe vera, sunflower. So it has good properties. And what we can try to do is that we will try to, practice it, put the cream on top. As I said, actually, if you were to Google, there's a lot of pro and cons about this component, because the science, as I said, is not mature. I mean, all the issue about endocrine system is still something the scientists is still working on it, and we do not have a really good grasp about what is going on in our body. So because it's very complex, the balancing act and so on and so forth. But we need to do something to at least trying to help our body to be able to balance this hormone imbalance.
That's right.
So I think one of the component is Eva cream. From the video that you saw, it's quite good. No animal or plant-based hormone being included, but what it's saying is that it will trigger your body to be able to produce hormone by itself. So there's always a kind of like a precursor kind of thing inside the system. And the beauty part of it also, as you can see from these 4 active ingredients, Dioscorea villosa extract is a wild yam. It's not new, it's been used for ages. It contains a precursor of self-produced hormone, which allow the body to produce our own hormones as required by the body.
Yeah.
It has the anti-inflammation, antioxidant. As I mentioned, it's also on the part of blood circulation. You see, the hormone is traveling all parts of the body, and so it will has to rely on our blood flow system. If our blood flows, that means our arteries and veins are working properly, then we can get to the level that the hormones will be able to travel. But once we don't have enough blood circulation, then we have a lot of problems. And so one of the issue also inflammation that cause a blockage. And so having a grapeseed extract as part of the component, then it will help soothing the joints, the stiff joints, the varicose veins. And then aloe vera is also, since we are applying to the skin, so aloe vera will moisturize and soften the skin for the material to be able to be absorbed. And the sunflower seeds is a kind of technology to encapsulate the essence of Dioscorea villosa and the grapeseed extract, so that it becomes a microgelatin to get into our from the skin. It gets to transdermal and gets into our organs, our glands. Yeah.
Yeah.
So
I think this carries from our previous discussion on how do we prevent endocrine disorders. So like we were saying, there are many different methods lah, medication being one, and medication or injection of medication, and then surgery if we have tumors, but hopefully it doesn't come to that extent, right? So if it is just a minor or no or endocrine disorders that requires just medication or injection of other types of hormones, I think we can always find a better way. That's why that's why Dr. Nazlee is introducing Eva cream as being one
Yeah,
of the alternative
yeah,
way, other
yeah.
than
To me,
other than just
to me, it's prevention.
yeah,
So we
yeah,
want to make sure our body has a good balance of
yeah,
hormones. So we will try as much as possible not to get to the level of disorders or
of course,
hyperthyroidism or hypothyroidism, or our adrenal glands not working properly, our
yeah,
kidney not working properly, our
yeah,
thyroid's not working properly, our pituitary glands not working properly. So
yeah.
if we have to that level of not working properly, that means we are a very regular customer to the hospital, which is not good. And so
Okay,
by
we have a question here though before we
yeah.
carry on. Sorry, let me ask this question on behalf of Maya. What kind of
Mm.
foods should we take to help overcome the problem of endocrine disorders? Now, before I let Dato answer, probably I think this is let me do some revision lah from a sharing by our nutritionist Wen Ching I think about 2 weeks ago, where she also shared some of the foods or fruits or veggie that we can take to improve the level of endocrine or hormone excretion in the body. Now I remember she talked about choosing different colors of vegetables. Okay,
Mhm.
try
Mhm.
to eat more and more. I mean, different colors of vegetables as much as possible. And very important, she talked about taking this soybean as part of our diet is very, very important as well. I mean, in general, taking good and quality protein, okay, is very, very important for our endocrine or actually for hormone discretion in our body lah. So when we talk about good quality protein, basically we're talking about foods that are not processed lah. That's a common sense lah. But the problem is most, if not all of us most times we would have difficulty finding foods that are healthy or whole foods or foods that are not processed. So that's why we come to this solution, Eva cream as an alternative, or as like Dato say, as a prevention measure. So Dato, I think I hope to be able to answer
Yeah,
part of
I think
the
what you are
question.
saying is excellent, and there's a lot of movement in the food industry today to reduce the use of chemicals. For example, in the past, when you buy the mie kuning, the noodles, they add in a lot of bicarbonate, and then you don't feel nice. But today, I
Yeah.
think they remove all those parts, and so today, I think people are understanding a bit more in terms of healthy, and even the processed food today, they don't want to process it so much by adding too much of preservative chemicals. So they're trying to get to the level. But as for example, one of the most problematic endocrine disease is diabetes. That means
Yeah.
in your diet, you have to control the intake of sugar.
Yeah.
And so these are one of the things that you have to do. For example, if I want to drink Coke, I have to drink Coke Zero lah. Sometimes you have to sacrifice because Coke, as you know, one can of Coke contain 9 tablespoons of sugar.
That's terrifying.
Because of the CO2, when they do carbonation of the drink, the carbonation blind the sweetness of the sugar. So they have to add a lot of sugar to be able to reach the sweetness level. But the problem would be when your body intake like 9 tablespoons of sugar in your bloodstream, that triggers quite a bit of havoc in your endocrine system. And one day your body system's out of control, out of balance, and that causes diabetes. And then you have no more ability to control the insulin level, and then cause the diabetes. So what I'm trying to say here, we have to make sure our diet is balanced. This is important. But the Eva cream is something that we say we would love all of you out there to use, because it helps the absorption and balancing of the hormones. And so what we're trying to get here is the prevention. So if you get into a good healthy diet, and good thing about this thing is using absorption. So you can put it areas that you feel you have, let's say, issues, and then you sometimes, your body got some area where you have inflammation, then you can put Eva cream on top. So that will definitely help uh, in terms of improving your health and your hormone level. And we hope by doing this you can prevent these endocrine disorders. As I said, the disorders will trigger because of all these bad habits: not enough sleep, not enough water you drink, not enough good diet, balancing diet. So these are forever. Actually, it's not easy. It's not easy. I mean, we always have the tendency, you like the food, you want to eat a lot. And so but then you have to put up some sort like a discipline. So I think discipline is important. And also with the knowledge tonight, I hope you out there learn a little bit more about our endocrine system. It's a very important system to take care, because for example, your thyroid is also controlling your heartbeat. If it's not functioning properly, you got your heartbeat haywire, you cannot control. So not only that, it controls quite a number of things actually. So if you were to read and understand from the book, it's actually the knowledge that we can find from the book is not 100% of the what is happening in our body. We can only understand bit by bit. So it's a continuous effort by scientists to understand the pathway, and the pathway is very complicated because our body has thousands and thousands of reactions, and so we do not know which one is the precursor for what, and then how the reaction is taken, where's the key enzymes that influence the production of certain things. So these are a ongoing process of understanding our body. But at least at this point, when you know that you have glands, it's important that you maintain it properly, and releasing of those hormones. There's quite a number of hormones, and also one of them is adrenaline. So if you get excited with things because your adrenaline rush, will say, I love adrenaline, like the Formula One driver, right? So they love to have this adrenaline rush. And so that's part of the adrenal glands working. If it's not working, then you don't have that rush. When you don't have that rush, you don't have that speed and ability to think fast, acting fast. And that's part and parcel of hormone balancing act in our body. So I hope tonight, we get a bit more knowledge about this issue. And how long will it take to see the results of Eva cream? So as I said, it will take some time. That's also the reason why this area is not easy to understand, because it is not like today I put the cream, tomorrow I can see the result. So it has to be a continuous effort. So maybe at this point, Mikhail, you would like to play a video on how do you see the result of Eva cream? Is that possible?
Sure. Yes.
Okay. I pass it back to you.
Eva cream works best to activating your self-produced hormones. We will apply Eva cream to 6 different parts of the body: neck, chest, inner arm, inner thigh, abdomen, and waist area. Use a spatula to scoop 1 full scoop of Eva cream for each part. Apply Eva cream evenly to the area around the neck, massage the lymph nodes from the chin to the ear, and then from the ear to the shoulder, and repeat the same until it is fully absorbed. Apply the cream evenly to the chest area, but avoid the nipples. For the first set, massage from the underarm to the upper chest area. For the second set, massage from the armpit to the lower chest area. Repeat until EVA cream is fully absorbed. Apply EVA cream to the outer part of the arm, from top to bottom and back, with a circular motion until fully absorbed. Massage the inner arm with a circular motion from top to bottom until the cream is fully absorbed. For the abdomen area, massage EVA cream evenly with a clockwise massage motion centered on your navel, from small circles to large circles, until it is fully absorbed. Apply enough EVA cream to the lower back area, and then gently massage with your hands until it is fully absorbed. Apply the cream evenly to the thigh area, then massage from both sides of the thighs, from bottom to top, then to the groin area. Massage the front part of the thigh, from bottom to top, to the groin area. Finally, massage the back of the thigh, from bottom to up, then to the groin, until EVA cream is fully absorbed.
All right, there you go.
Okay, so yeah, thank you for sharing, Mikhail, on this. How do we apply your EVA cream? So we suggest a 433 treatment cycle. So that's how we hope to see the result after a couple of months. So as you can see, the first month maybe you have to use 4, and then the second month 3, and then the third month 3, and then you the healthy state you only use probably 2 for continuity, right? Okay, right.
Yeah, this is based on the our studies and experience over the last about 25 years of using EVA cream. 25
so
years, imagine.
433
Yes, for 25 years, our customers and our friends, even myself and my family, we've been following this. So at the start of the treatment cycle, we start with start using 1 bottle of EVA per week. That's like 4 bottles a month, no? Then we can slowly come down to 3 in a month and 3 in a month. Then after, when our endocrine system is okay and our hormone secretion is balanced, then you can choose to use 1 or 2 bottles a month for jaga lah, untuk apa ni, for maintenance. Yes, exactly. Mm-hmm.
For the first component, I think because it may take some time to get the body, the system to well absorb.
Exactly. The reason and the study behind this 433 treatment cycle is because when we have a prolonged lack of raw material for our hormonal glands to produce the necessary hormones such as adrenaline or insulin, so it's been some time. It doesn't happen overnight, right? The lack of hormones. So it's been some time. So because it has been a long time, that's why when we start to do this treatment, we need to give enough, actually more than enough. We should give more than enough of raw material into the body, so that the body has enough material to produce what we need in the body.
Okay, good. Thanks, Mikhail. And so these are the 6 main areas for absorption. So I think we saw the video. And this brand that moved hundreds of thousands of people worldwide. So I think this is something that we would love to share with other people. And I think I also apply this cream behind my neck, to have my balancing. So it does help give me a bit more clarity and balancing, and so we hope this will benefit a lot more people out there. And as I mentioned, endocrine system is very complex, and we do not want to have imbalance of hormones. It creates havoc in our body, and then one of the symptoms of cepat marah, especially when you reach the level of menopause or andropause, you got cepat marah. So hopefully
Yeah.
by taking this cream, kurang marah, you get less angry to bad people. Because sometimes you can get triggered very easily, get annoyed
Yeah.
very easily. That's also kind of component that you don't have enough balancing in your hormone, I think.
Yes, yes,
So,
yes.
all right. So I think Eva cream for better you every day, and as I mentioned, uh, obviously scientists also still working on it, and we hope in the future we have a bit more evidence of what we're trying to do here. But I believe with this EVA has been used for quite a number of years. Yeah, this is one of the most important products from Omni. Uh, and we see results coming out. People are saying that they feel much better. They kurang marah. So I think that's very important. So, but anyway, thank you very much for joining us tonight. And maybe one of the early 2022 resolution to regularly apply EVA cream and gets our hormone to be balanced, and we hope to be healthy, and it will give you a better you every day. Thank you, Mikael.